Do nothing much. It's kind of slow here today. Let's grab a left ankle to see if we can make some sense out of it. Also a right ankle, same patient, both sides. It says pain and instability, no trauma nor surgery. So it should be normal, right? I suppose. Can I tell if it's right or left? This is right. Right. This is the right ankle. It says here it's right ankle. You guys can't see, but I can. Yep. It seems to be the right ankle. I don't like to start with coronal nor axial. I'd rather just check to see. Oh, this is a huge ankle. Obese, 42-year-old female that has ankle pain. So it is supposed to be something. It is supposed to be a painful disease. Let's check for all those bone stress fractures and articular joint effusions and bone edema and all that good stuff. That is quite painful. So this is the sagittal view. This is a T1, no fat saturation. This is a PD or a T2, usually a PD, a proton density weighted image. It's not a STIR because this is a very common fat saturation artifact on PD fat saturated. This isn't much. This is quite a nicely done scan. Can't really complain much. I can see right here there is a small site of bone edema, most probably, but I can really relate this to this image. So this could be just a acquisition artifact due to a badly done fat saturation pulse. So see, this could be edema right there. This not so much because it's plain white, bright in the T1, so can't really tell. There is some edema right here, or maybe a small hemangioma. Nothing much. We have a tiny spot of signal hyperintensity on the PD fat saturated sequence right there at the extremity, the enthesis of the plantar fascia, and we can also see the same spot right there on T1, which tells us this could be a pressure, hyperpressure lesion due to obesity. Of course, we also have some, it seems to be some kind of scar tissue here at the Cager fat pad. And we also have some edema right here at the plantar calcaneal fat pad right there. This is all quite painful. We should really, if it's a painful ankle in a obese female and there is no history of trauma, it makes sense. And there is a small joint effusion right there on the talocrural joint, the main ankle joint, which is also reasonable for this case. So right there is indeed edema right there around the plantar fascia, right at the enthesis, the posterior extremity of it. There is also soft tissue edema right there. Let's see if we can manage to see any signs of bone edema. I don't think this is edema. This is probably a focal bone lesion, which I'm going to ignore.